What should you do when your 7-year-old wants to sleep in your bed?
Oh, good topic.
Point.
We see a lot of these questions with blended families, with single parents. Children wake up in the middle of the night, they wander through the hall, and while you're sleeping, they might find a way to insinuate themselves into your bed. And if you're a couple, you know that that's going to be disastrous for your sex life, because once you let them stay in your bed, then it sets a precedent. And then the next few nights, they're coming into the bed and expecting that you won't make a fuss. So the best thing is to head it off at the pass the first time it happens. And if you tell them, Mommy's and Daddy's bed is for Mommy and Daddy. Your bed is for you. And if you can't stay in your own bed, and you have to come into Mommy and Daddy's bed, you can't stay in our bed, but you can stay beside the bed. Okay. And if you want, take your blankie, take your sleeping bag, and sleep on the floor.
Hold that thought, because we've got another segment with you. We'll come back right back with you in just a minute. We'll be back with Dr. Eva Fisher. And just a question was, what should you do when your 7-year-old wants to sleep in your bed? And during the break, we asked you, Dr. Fisher, when does this start? Is this something that starts at an early age, and then by the time they're 7 years old, it's just an automatic thing?
It could start at any time. Sometimes there's changes in the family, and the child has some anxiety, and they haven't learned how to manage their anxiety on their own, so they look to the parents to help them. But if your way of solving the problem is to get the child to come and sleep in your bed, because, well, there is some self-serving activity about that, because you just get more sleep.
Right.
But then you cause another problem in solving one problem, and the second problem that you've caused is more difficult than the first one, because once the behavior is established, it's much more difficult to get the child to leave your bed. And the child is not going to take it well if you say suddenly, well, Mommy and Daddy have to have their own bed to themselves, and now you have to go to your own bed, once it's been an established pattern. So you're much better off to train the child not to come into your bed at all. If you're scared, you can stay beside Mommy and Daddy on the floor, but the floor is not comfortable. So they will learn on their own that, well, you know, the floor is not really good. You know, it's cold, it's hard. Maybe I'm better off in my own bed, but do not let them go into your own bed.
Okay, good advice.
Yeah,
really good
Something
advice.
I have to listen to. Because, you know, you want to console them, but during the break you mentioned that they do have the ability to self-soothe themselves,
yes.
right?
As long as there's no physical problem that's interfering, like real pain or real colic or some physical, or any changes in the family that's really distressing, and those things could be talked about during the day, so that when it comes to nighttime, it's not interfering in their anxieties, and they've already talked about their fears and their anxieties, their losses, their sadness. If it's something like a grandparent has just died or some changes in the family have happened, then that's something much better discussed in the day, but not at night.
So if parents are bringing crying babies in the middle of the night to the bed to soothe them, at what age, when should they start to think, well, I should stop doing this?
Well, first of all, if it's a small baby, it's very dangerous for the baby to sleep in your bed. Because if one of the parents rolls over, then that's not going to be good for the child. So if you want to keep the baby in the bed, or at least in the bedroom, you could use a little bassinet if the baby is small enough. And that way you can reassure yourself that the baby's okay. And that's okay for a couple of months. But as the child gets older, the worst thing that you can do is to create a habit where the child is going to be expecting to sleep in your bed every night in order to have you soothe them. The idea for children in growth is to encourage them to learn how to self-soothe, and your voice will be in their head and soothing themselves if you give them a chance to. Babies can self-soothe.
That's great, Dr. Fisher. Good point.
What do you say?